So the Cadaver course was initially designed for just advanced implant surgeons to go and learn advanced techniques. And it's, as you say, it's a 3-day course. So the first day is intensive lectures. Now, they are lectures with an intention to challenge opinions and ideas. So lots of the current fashions and so on are brought forward, and the challenge and the discussion. So it's very interesting. And the basic sciences are also covered to make sure that it's a review of basic sciences, meaning anatomy, bone physiology. The other 2 days are full-on, hands-on, with 2 dentists per head. So we get quite full exposure basically to one side, where we start off from, again, basic suturing techniques, various suturing techniques, to placing an implant, GBR, doing block grafting, soft tissue grafting, sinus lifts, and exploring the anatomy. So there's quite a lot you can cover. People loved it so much after the course, and they were so encouraged and excited by it. We thought, you know what, that's why we introduced it for the basic level as well. So people can actually, once they've done the training, as part of the training, they actually work on a cadaver as well, which is fantastic.